Okay.
A very good afternoon and welcome to our session on the topic Healthy Lifestyle in Pregnancy. We are glad to have Dr. Maitri Sharan from Apollo Cradles and Children Hospital, Jubilee Hills, among us today to help us understand the topic. The doctor will help us understand more in this session today in details, so stay tuned. Also, if you have any doubts, any queries, put them on the comment box down there, and our doctor will take all your questions by the end of the session. So stay there till the end and solve help a doctor solve all your queries. Doctor is there for you. Doctor, you have the stage now.
Hi, thank you so much for introducing. So, let us start with our healthy lifestyle in pregnancy. So, whenever we see healthy lifestyle in pregnancy, as pregnancy is a memorable journey and we will be going through so many up and downs, we have to know what lifestyle we are going through and what we have to do in the pregnancy to have a peaceful journey. Okay, so coming to the topic, whenever we see these two lines in the pregnancy, really we feel good and we receive lot of different emotions from all over the things, but the question actually starts like what exactly we have to do. So it's not always normal and like overwhelming journey to everyone. We have a mixed emotions, and some people they'll be confused how they can continue the pregnancy, how they will have lot of doubts like what food they have to take, how they are going to continue the pregnancy, is this everything is going to be fine. So let us discuss all the things which you have to go through, and we will listen about this. Okay, coming to the most important topic, that is stages of pregnancy. We have to know the first stages of the pregnancy. So it is divided into three trimester. When it comes to the doctor, we divide into three trimester, that is first trimester, second trimester, and third trimester. First trimester is like, in simple words, we call it as first 3 months. Okay, that is first week to 13 weeks, almost we consider it as 12 weeks, we consider it as first trimester. When it comes to the second trimester, it is about from 14 weeks to 27 weeks. And when it comes to third trimester, it is from 28 weeks to 40 weeks, which is divided as first 3 months, and from third month next to fourth month to seventh month, and third trimester is seventh month to almost 10 months, that is date of delivery. So first trimester we calculate from the last menstrual period. That is, in the sense, when you got first day of the last period date, when you have that, your period is missed, then we consider it as from the last period date to the 12 plus weeks as first trimester. So coming to the first trimester, as I told, it is encountered from the first day of your last period date to the 12 weeks. And usually, what are the things you see in the first trimester? As everyone says, it usually we accompany with all other different things, because as it's the first trimester, we have mixed emotions, and you have to know what exactly we have facing in this trimester, especially the morning sickness. Morning sickness is nothing but it's a vomiting sensation, and it's vomiting like feeling sensation, that is nothing but nausea and vomiting, and you'll have mood swings and also tender breast, frequent urination. These all are the things which we usually see in the first trimester. And coming to the thing, everyone asks me, like when they come to the OPD, they ask like, is the first trimester very risky? When discussing whether risky or not, in some way it is risky, because embryogenesis and organogenesis takes place during the first 10 weeks, and that is like in the first trimester. So we have to be very careful. Unnecessary exposure to the unsupervised medications and unnecessary lifestyle things, like whatever drinks, whatever drugs which we take, and unnecessary exposure to radiation, and all these things are very important in the first trimester, which affect the organogenesis. In that way it is very risky. But in other ways, nature itself has created first trimester very robust and very tough, so that normal moderate exercises, stress, and other things usually don't affect the first trimester. So because it's a very nature created thing, usually we won't find risky times. So in that way, it is risky in some ways and not very risky in other ways. So what usually we see, so during the first trimester, we will be seeing, as I mentioned, morning sickness. For some people, it might be morning sickness. Some people, it might be evening. Some people, they may have in the night also. But normally, we'll be talking as morning sickness. And some people may have severe morning sickness, always vomiting. And some people may not have any other sickness during the pregnancy. So it always depends upon to the people to people. So it cannot be always the same. For one person it might be the same, and it is not always same even in the first and second pregnancy. So in the first pregnancy, some people may have lot of vomitings, but maybe in the second trimester you may not have anything. It might be vice versa, and some people may have lot of no vomitings at all in the first trimester, but second trimester they may have the risk of vomitings in the second trimester. Usually, what are the risks we usually see in the first trimester? Most common is neural tube defects, and miscarriages, abortions are all more common in the first trimester. So usually, what is the main thing we have to consider is during the first trimester whenever they come, I always say visit the doctor is very important. First, foremost thing, whenever you miss the periods and if you have unprotected sex previous period time, and if you missed the periods, meet your gynecologist immediately as soon as possible. And doctor will take your history on like what medications are you, or if you have any other medical problems, pre-existing things. If you're on any medication, doctor try to sort out the medications and change the medications which are favorable in pregnancy. And also she will go through the family history and accordingly ask for the investigations, and also ask for the scan to see the heartbeat exactly where it is in the uterus or in the tubes, or documents your all the history and accordingly your symptoms. So first foremost thing to be done is meet your gynecologist. Second thing is start the folic acid supplements. Folic acid is it's a part of the prenatal medications which has to be taken 5 mg per day. Is prenatal medication which you have to take. And when you visit your gynecologist, he starts you on the normal multivitamin, that is folic acid, which actually has to be taken. It is called as pre-engagement pill also. That means prior to that, everyone used to take 3 months prior to the planning pregnancy. In other ways, preconceptional counseling, which helps a lot to start the folic acid earlier, or if not started, at least in pregnancy you have to start the folic acid during the pregnancy. And coming to the history and other things, we will go through the history and we will sort out all the problems, and we will ask the basic thyroid test, because thyroid initially the fetus thyroid develops at 10 to 11 weeks. Meanwhile, mother should not have hypothyroidism, so that baby will not suffer with the hypothyroidism symptoms. So that's the reason whenever the mother comes, when we see the heartbeat or when they are pregnant, first of all we will do the investigations first, that is thyroid test, and we start on the folic acid. And anything they are having problems, we'll go through the history. Coming to the second things, adequate control of diabetes, hypertension, thyroid disorders. As I mentioned, like if they are having pre-existing, I'm not talking about normal things. If they have mother is suffering with the other conditions like diabetes, hypertension prior to the pregnancy, we have to change the medications. If they are on diabetes, we have to see other which are affected by the diabetes. We have to see the other organs which are being affected, and we have to manage. Coming to the things, lifestyle modification things, that is one of the thing is alcohol. No alcohol is allowed in the pregnancy. Even there is no safe limit in the pregnancy of taking alcohol. So definitely there is no alcohol once you are pregnant, and it is always better to reduce the alcohol if you are planning for the pregnancy also. So when you are exposed to the alcohol and if you are pregnant, there is a chance of fetal alcohol syndrome. So definitely there is big no for the alcohol during the pregnancy. And coming to the recreational drugs and other drugs are also no in the pregnancy. Otherwise, most important one is caffeine. Everyone, this is the common question. Usually, we always go through how much caffeine do we take do we need to take, doctor? This is a common question. Is the limit caffeine intake to 200 grams of caffeine per day is the limit? But when I say 200 milligrams, definitely it is very difficult, right? So I say like a small cups of 2 cups of coffee is maximum per day. You cannot take more than that. And caffeine is not only present in only in the coffee, it is also present in the dark chocolates, and it is also present in the green tea and some of the chocolates. So overall, you have to see what you are taking, and it should not be more than 200 milligrams per day. Coming to the other thing, very, very, very important is avoid self medication. You cannot take just self medication, that too in the first trimester, because you should not be exposed to the too much of medications in the first trimester. That too, self medication is big no in the pregnancy, because as I told, like embryogenesis is the most common in the first trimester, which is more exposure to the medications. It may affect the organogenesis, and please avoid the self medication. It might be antibiotics, it might be painkillers, or it might be any other things. Coming to the pets, I know so many people are fond of pets, but especially when your people are fond of cats, so you have to be very careful. When you're really fond of cats, the only thing to avoid is cleaning the litter. It has to be avoided, because through the cats we have something called toxoplasmosis parasite enters into the body, especially during the pregnancy. So it's always not. I always tell not to clean the litter of the cat, so that at least we can avoid all these problems, especially toxoplasmosis. Coming to the avoid raw uncooked meat, that is definitely because there is we should not cook, we should not eat uncooked meat, especially like sushis and all. It's better not to take during the pregnancy, because salmonella and listeria are more common, which affects through the uncooked food into the body. So we have to be very careful. So big note, during it's always better to wash, clean, and cooked food during the pregnancy. Coming to the avoid oily spicy food, and it always eat in the small intervals, like I say always to all my patients, especially in the first trimester, because first trimester we usually face the most common problem is gastritis, nausea, vomiting are the most common problems, and it won't be always pleasant to all the patients, because these are, and you won't expect more to eat during this period, because these are the things which you usually see during these things, so that they may affect your food intake. That's the reason I always say, when they come ask especially what food we should eat, I always say avoid junk food, avoid maida food, and avoid all the chips, because we don't know what type of oil they are using, and always fresh and washed vegetables are always important rather than eating organic and uncooked food. I always prefer all these things to be very important, and all the fruits can be taken, especially raw papaya and raw pineapple are not allowed in the pregnancy. Coming to the, okay, all this time we discussed what not to eat, what are harmful to the pregnancy. Now the most important thing is something natural remedies also to reduce the nausea. One of the biggest thing is ginger. I always tell for the patient, not only use vomiting tablets, but if they're having severe sickness and all, I usually advise them to take ginger. Ginger available as ginger tea or ginger candies, ginger anything you can take, and you can keep inside your teeth or mouth, so that slowly the lozenges or whatever ginger related usually reduces our nausea and vomiting in the pregnancy. So consume fiber rich food. It's always important we have to take rich food, and also lot of water has to be taken in the pregnancy. This helps in the hydration and also help in the reduce in the constipation. So moderate exercise is always important, and always sedentary life is very bad in the pregnancy, though you are pregnant, unless if you have any other risk factors, or if you have any other problems, if the doctor only mentions you not to do any exercises, or if she specially mentions not to do anything, or if she says complete bed rest, till that you have to have the moderate physical activities. It might be yoga, it might be gym, it might be pilates, it might be whatever reasons. Just normal walking itself helps. At least 30 minutes aerobic exercise walking itself helps, and it maintains your hormone levels and also helps in the healthy lifestyle. So definitely walking is always, but when you are trying the new things, like if you're starting, if you never have done the yoga and suddenly starting yoga, it's always better to have all this with a trainer rather than doing our self things by seeing or watching all this YouTubes and all. So especially, but always I mention good food, good lifestyle helps you enjoy the motherhood very nicely. Coming to the other things, acne and some pigmentation problems become more bad during the pregnancy for so many people. So, but some medications are very important, and I have seen so many people using new regimen, new routines in the pregnancy. But in that, you have to be very careful, especially when you are using the creams and medications. It should not have retinols in their creams. You have to be very specific about the ingredients, so definitely no retinol during the pregnancy. So as I mentioned, taking prenatal vitamins, especially folic acid, is always important. Quitting addictions to cigarettes and alcohol is always important. Maintaining a wholesome pregnancy diet while avoiding raw fishes, meats is very important. Staying active with non-strenuous, moderate level exercise during pregnancy, and practicing yoga, meditation, breathing techniques only to lower the stress during the pregnancy, and reaching your doctor in case of unresolved emotional difficulties, because even psychiatric mood difficulties are also important role during the pregnancy, which you should not neglect. And any problem, please meet your doctor or meet any of your counselor, but please take help during the pregnancy, because it's not always normal for everyone. So I usually be seeing, talking to the patients, and patients, I observe that all patients cannot be happy, okay, because it's entirely something new thing has been coming up inside their body, and in their mental status and their physical status really takes toll during the time for some people. It's not always like, okay, congratulations, making everyone happy. There are some cases, really they'll be in a confusion state, they will be in different mood problems, like whether I'm going to continue or not. They have so many doubts during the pregnancy. So deal accordingly, and help your friends or whoever needs their help. And definitely one thing helps is meeting your doctor on time is always important. Now entering into the second trimester, I always say it's less burdensome period trimester, and it's a most enjoyable period of the pregnancy, because you'll be seeing all your tummy changes. You can see the enlargement of your tummy, and all your nausea, vomiting symptoms comes down, and you start eating and you enjoy the food and you enjoy everything. So definitely this is the most enjoyable period of the whole pregnancy, and you can see that pregnancy glow also. So what are the risks during the pregnancy? So as I told, there are fourth, fifth, and sixth month is completely second trimester. So usually we don't see much problems in this. As I told, your tummy will be increasing and you'll be enjoying, and you'll have the food cravings to eat the food. So definitely in the fifth month we will go for the TIFA scan. That is the most important scan. That is like anomaly scan, which we do in the pregnancy. So anomaly scan especially is useful because here we check all the organs in detail. If any organ has any anomaly, we usually detect in the pregnancy, so that we can take decision further in the pregnancy. So it's very important. No one has to miss this scan in the fifth month. Followed that, in sixth month, usually, normally, the sugars levels will be increasing. That is, carbohydrate metabolism in the body will be changing from the 24 weeks. So that's the reason we check the sugars at the sixth month of the pregnancy. And usually we check with the glucose challenging test. We give the glucose and we check the glucose challenging test, and we see the whether the mother is suffering from the gestational diabetes or not. But there are conditions which they are having over diabetes. That is like in the pregnant prior to the pregnancy, if they are suffering with the diabetes, usually we don't go for this test. We start the treatment from starting itself, and monitor the sugars properly. But in this case, we check the sugars, and if the sugars are high, accordingly we will manage with the diet and according insulin or any other medication with the endocrinologist. So other, what are the milestones usually we see here is, usually we feel the moments, first moments of the baby, and organ seeing mature, and all these things usually we will be seeing in the second trimester. So as I told, mild pregnancy symptoms, most symptoms are whatever you suffered in the first trimester, like nausea, vomiting comes down drastically, and these dental problems are all more common. But most common risk compared to miscarriage, which is more common in the first trimester, we usually see gestational diabetes more common in the pregnancy. What most key points are, like, again, as I said, healthy lifestyle is very important. Stay active is always, and stay healthy food, eat healthy food is more common. And as I want to, one more thing I want to mention is always sleep pattern. Sleep is also very important. You just cannot sleep randomly whenever you want, or just hold your phone and waiting for the sleep cannot happen. So early food always make you the digestion better, and as the tummy is increasing, and if you are eating at the late timings and you are expecting to sleep, it's very difficult. That's the reason I always tell my patient in the second trimester to eat early and go for a walk, and then come and stop your phone and just lie down, because sleep is also very important to change all these things. Okay, so good sleep, good food, staying active and being healthy, and meditation, yoga, all this mental fitness, it also helps to carry your motherhood very pleasantly during the second trimester. And coming to the sleeping pattern, sleeping on the left side is always better rather than sleeping on the straight or on the right side. So it's always very difficult, and we become paranoid sleeping on the left side, right? But preferably left side or right side, but not on the straight. Okay, supine. So second trimester milestones, usually, as I mentioned, first movements, Lanigo covers the hair. This is not, you are not involved. Organs continuing maturing this time. So second trimester schedule, if you have any dental problems, scheduling a dental checkup, as periodontal disease can increase the risk of complications like preeclampsia in some studies. So you have to be very important. And having the balanced pregnancy diet and having good yoga and exercise and nutrition is also very important. Now coming to the third trimester, this is also very simple period, but the mother is little worried about the delivery and the baby growing. And here the most part, the important thing is we will be monitoring the baby growth. Okay, so this involves seventh, eighth, and ninth month. In the seventh month, the baby growth starts, and we start checking the growth scans from the seventh month. Is the baby is growing in the correct way? The food what we have taken, the nutrition or any other medical problems are going to affect, will be seen from this month. So seventh month we see the growth scan and see the baby, how the growth is there, and how the Dopplers are there and everything, blood supply and all. Most common symptoms here are again swollen pedal edema. That is, like, you can see the swollen feet in the feet, and you will feel the lower back ache. And in the eighth and ninth month, especially in the middle to ninth month, you will be seeing Braxton Hicks contraction. You feel like it is in the labor, but it is not labor. It's a false labor. Usually, we will be seeing. The most common risk during the pregnancy is if they are highly prone for the hypertension and all will be more common in the pregnancy. And we'll be checking how is the fluid, how is the growth, and how is the activity of the baby during the pregnancy. So during this third trimester also, if they don't have any other medical complications or any other high risk things, if the doctor advises, continue the physical activity. And also we advise the perinatal exercises during the pregnancy, which helps in the which prepares a mother for the childbirth, and also helps in the exercises which helps to relax the ligaments and all, and it prepares for the baby for the childbirth. And especially these perinatal exercises, which are very important, we give in our hospital also, so that and also we give the classes about the childbirth, so that you will understand the proper process about the motherhood. And when the situation comes, the mother prepares herself with the all these things, and they will be ready for the pregnancy, because it just cannot happen suddenly at the ninth month. If we say, like, baby is going to deliver, and if they are not prepared or anything, it really causes severe mentally weak, and they cannot help in the progress of the labor. So definitely childbirth classes and yoga, which helps from the seventh month, especially if they don't have any other risk factors, and if the doctor suggests for to go through all those things, it's always better to go through. And ninth month after, we just go with the 10th month is the normal date of delivery is through during the 10th month, and we see if no other complications during the 10th month we fix for the delivery, or if they have any other problems, or if you are planning for the C-section according to your gynecologist, they will plan. So usually in the third trimester, as I told, swollen feet, fatigue, and lower back pain, Braxton Hicks contractions are very common, and the risk like low amniotic premature birth are very common. So only thing is, third trimester you can see nicely vigorous kicks and movement, and organs almost reducing, finished maturing, and rapid weight gain will be seen. And baby, you can feel the light weight through the down, because as the baby head will be drooping down, so you can feel the weight, light weight during the, especially in the pelvic region. So what are the tips during the third trimester? Taking frequent breaks and elevating your feet as often as you can, because to reduce the swollen legs, it's always to keep the pillow at your foot side during sleeping also helps her better. Wearing well-fitted, comfortable shoes for walking and all is very important. Sometimes when you ask me about the pregnancy pillow, is it's up to you. If you want the support for the pregnancy back and knee, you can go for it. And moderate level and regular level, low level exercises really helps, and especially for normal delivery, being physical active only, we can go through all this process easily. Thank you. I think I have told almost all the things which you have to do in the first, second, third. If any doubts, please mention in the chat box. So questions are like, sorry, Tina ma'am, for fifth month. Can you ask the question clearly? Somebody's asking question, but the question is not clear. Can you please ask me in detail? Yeah, Tina, what is your question? Can you please ask in detail? Okay, I think questions are done. Hmm. Okay. Okay, if your fifth month starts, you please get your anomaly scan done first thing. And after the fifth month, what precautions? Okay, the most important precaution is from the hospital side, you have to get your scan on right time. That is especially fifth month anomaly scan, and see everything is fine. After that, you have to continue your healthy food, like as I mentioned previously, and physical activity you have to continue. And at the sixth month, you have to go for the sugar test. Meanwhile, good food, good sleep, and proper hydration and the fiber food is very important. With scan, it's like anomaly scan. We called it as DIFA scan. The scan has to be done. Any other questions? Thank you.